I'm Amanda Olson from IntimateRose.com, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And today we're going to go over some position changes that you can use while using your vaginal dilators or wand that are helpful to relax the pelvic floor and can also help you to prepare for a goal of pain-free intercourse, or can help in the day-to-day activities that require some different body movements. So I'm going to show you a couple of them. Pick the one that works best on your body, and it may be all of them and you use them interchangeably, and you may find one that just really works for you. I will add in that it is always a good idea to implement body position changes when working with your vaginal dilators if you have a goal of pain-free intercourse. The reason being is because during intercourse there's a lot of different body position changes, and it's helpful to train the pelvic floor to relax during those instances in a controlled environment during your personal training time. So the first position I'm going to show you is hands and knees position. So this is just simply on all fours like this, and you can be using the wand or the dilator in that position. The next position is laying on your back with feet up the wall, so you can plant them and allow the knees to just relax and open. And then the last is a deep squat, and it's just right here in a deep squat, supported against a wall or even in a corner where you have support on both sides of your body, and you can be using the vaginal dilator or the wand in this position. So again, find the one that works best for you and use it, and if you have any questions, don't hesitate to reach out at support@IntimateRose.com.